this time, we call Dr. Sapp to the stand.
Would all the witnesses please raise their right hand? Do you swear to tell the whole truth, nothing but the truth, so help you God?
I do.
You're all formally sworn in. You may begin with your line of questioning.
Thank you, Your Honor. Please state your name for the court.
My name is Dr. Joshua Sapp.
What is your occupation?
I'm the Brookman Medical Examiner.
What prior education have you received?
I received my undergraduate degree at UT, my medical degree at Johns Hopkins. I performed multiple trainings at the New York University Medical Center. I'm certified in anatomic and forensic pathology by the Board of Pathologists. I am also licensed to practice medicine in 6 states, including Texas, and I performed over 2,000 autopsies.
Your Honor, at this time, we would like to enter Mr. Joshua Sapp as a medical expert.
Is there any objections, counsel?
No, Your Honor, there's not.
Okay, Mr. Moore.
Your Honor, may I approach the bench?
You may.
May I as well, Your Honor?
Yes, sir.
Your Honor, at this time, I would like to mark this as prosecution's Exhibit A and B.
Is there any objections, counsel?
Yes, Your Honor, I object to Exhibit B. I see no need for the picture of Annabelle to be entered in that.
Do you have a response, counsel?
I simply wish to ask some questions about the girl picture.
Okay. Do you have a use for the picture?
If you wish, I will.
Okay. Seeing as you do not have a proper use for the picture, I am only going to allow Exhibit A to be pictured right now, sure.
Your Honor?
Yes.
Yes, may I approach for recognition? Can you please identify this document?
This is the autopsy report?
Is it true and accurate?
Yes.
Is this your signature?
Yes.
Thank you. May I approach the bench?
Yes, sir.
I would like to move this into Exhibit A.
Okay.
I didn't say
Is there any objections, counsel?
No, Your Honor, there's not.
Okay, so moved.
May I return to my seat, Your Honor?
Yes.
May I ask? What was the condition of Annabelle Lee Colson's body upon arrival to Brookman Hospital?
Upon the arrival, the body was extremely malnourished and it was very thin. It seemed almost neglected to a point where any of the things that happened should have been fairly obvious to anyone.
When did you perform the autopsy on Annabelle Lee Colson?
I performed the autopsy on February 2nd, 2011.
What disease did Annabelle die of?
Animal died of DKA, or diabetic ketoacidosis.
Can you please describe what DKA is for the court?
DKA is a disease in which, where the body has diabetes, what happens is the body does not produce enough insulin, and therefore the body must produce to burn fats and acids of the body and therefore produce ketones and acetones. The pH level is then increased, therefore rising the potassium level as well, killing the patient.
What treatments are there for DKA?
There's a very simple insulin treatment available at all hospitals.
What are the symptoms of DKA?
Symptoms could be such things as lack of interest, malnourishment, thinning, and various other things.
Can these symptoms of DKA be treated at other places? And if so, please give examples.
If caught early on, this is a very easily treatable disease. It could have been fairly obvious for any parent to get this disease and to get a treatment for it easily.
What can be done for DKA outside of the hospital?
You can buy insulin shots from any local medical store. It was very obvious to buy these.
What is insulin?
Insulin is a hormone produced by the pancreas, and it regulates the blood sugar levels of the body.
Why do people with diabetes need to take insulin?
Because of the lack and deficiency of insulin, people need to take insulin to regulate their blood sugar levels.
How obvious of a disease is DKA to the untrained eye?
DKA is
Objection, Your Honor, this calls for speculation on the part of the witness.
May I respond, Your Honor?
Yes.
He is a medical expert. He can know what it was. He can know what it's like not to. He has the expertise to know what it would look like to the untrained eyes as he sees it every day.
May I respond, Your Honor?
No, seeing as he is a medical expert, I am going to allow this medical objection.
Thank you, Your Honor. Would you like me to repeat the question?
Yes, please.
How obvious can DKA be to the untrained eye, in your expertise?
Even with an untrained eye with no medical expertise, this should have been obvious for any parent or guardian such as Don Colson.
other medical conditions were found during the autopsy?
Posterior callus rib lesions were also found.
Thank you, Your Honor. At this time, we'd like to pass this.
Are you prepared to cross-examine?
Yes, Your Honor, we are.
You may begin.
Hello, I'm Josh Rance. We're just going to ask you some questions to clarify the truth about what happened. If you don't understand or need me to rephrase, please let me know.
Okay.
Are you aware that before the trial, when you had that deposition that produced your affidavit, you were instructed to include everything you knew that could be relevant to this trial?
Yes.
Was Annabelle deceased when she arrived at the hospital?
She was deceased before she arrived at the hospital.
When did she die?
She was pronounced dead legally at 4:50 p.m.
Was she in the care of the hospital at that time, doctor? Yes or no, please?
She had died before that. And the ambulance had tried to revive her using defibrillators, and then brought her to the EMT, who also tried to revive her. She was legally pronounced dead, but it was obvious that she was dead before that.
But she did die in the care of the hospital, correct, doctor?
Not in the care of the hospital, no.
Your Honor, may I approach the bench?
Yes, you
May I just off the floor?
Your Honor, I would like to mark this as Exhibit B.
will be exhibit A for the, is there any objections?
Yes, Your Honor.
Yes.
No objections, Your Honor.
Your Honor, may I approach the witness for
Yes.
identification? Doctor, will you please identify these two documents for me?
This is my affidavit.
Is it true and accurate?
Yes.
Has it been tampered with in any way?
No.
Thank you, doctor. May I reapproach the stand, Your Honor?
Yes, ma'am.
I would like to move this as Exhibit A for the defense.
Evidence.
Evidence A.
Is there any questions? Counsel?
No objections, Your Honor.
I would also like to approach the witness with evidence A of the defense and evidence A of the prosecution.
No objections, Your Honor.
Yes.
Will you please read from she to 450, doctor?
She was pronounced dead at 4:50 p.m.
I'm sorry, the she up here.
She did not.
No.
She was then transported to Brickman Hospital.
And from she to 450, doctor.
Resuscitation efforts were not successful, and Annabelle was pronounced dead at 4:50 p.m.
Thank you, doctor. And will you please read wow to R?
While some symptoms can vary in diabetics, in addition to high blood sugar, some of the noticeable symptoms of DKA are
And will you please read those symptoms?
flushed, hot, dry skin,
Thank you, doctor.
blurred vision, feeling thirsty, drowsiness or difficulty waking up. In children, there's a lack of interest in normal activities, rapid, deep breathing, a strong fruity breath odor, loss of appetite, belly pain and vomiting, and confusion.
Thank you, doctor. Your Honor, may I reapproach the bench?
Yes, ma'am.
I'd like to return these to you. Your Honor.
Thank you.
May I return my seat? Thank you, Your Honor. Doctor, is it fair to say that Doc Colson could have taken some of the symptoms as flu?
No, the symptoms were so extreme to the point where that it should have been fairly obvious for any parent to see that this was extreme, and she should have brought him to a hospital very quickly because this was a very dangerous disease, and he should have noticed this earlier. Don Colson should have brought his daughter to
Excuse me,
the
doctor.
hospital earlier.
Doctor, I ask that you try to stay close to the question. I'm asking, is it possible that with what you just read, the variation of symptoms, isn't it possible for some of the symptoms to appear as flu to Mr. Colson?
No.
Yep. No? Why was the body warm after 3 days in the refrigerator, doctor?
The body was warm after 3 days because what happened, according to state regulation, we are supposed to cool the body, and then we're supposed to leave it out for 30 minutes to an hour before examination of the body.
How does one receive rib lesions such as Annabelle's?
This could have been from numerous amount of things, such as simply falling down and cracking her ribs, or this could have been like, she could have, a numerous amount of things could have caused this.
Is it possible that when the detective carried her, he caused her harm?
No.
Is it possible for the detective to have known she had any internal injuries?
He has first aid training, but he could not have absolutely known.
What was Annabelle's weight?
Annabelle was 28 pounds.
Would you consider her malnourished?